Hi, everyone. So because I care about your cardiovascular health, if you feel like you need to stand up and move some of your circulation at the end of the day, please feel free to stand up, stretch, do what you need to do. Thank you to the Academy for having me here. I have been almost brought to tears a couple of times listening to the incredibly powerful, impactful ways in which folks in this room are contributing to health equity, and I really appreciate that, and I'll take that home to Arizona to practice. So I'm going to talk about the U.S.-Mexico border. How many of you have been to the border? How many are from the border? Woohoo! All right, so it's a good audience to talk to you about. Oops. This way. Okay. So I'd like to begin by just getting us thinking about transcending borders and boundaries and really reframing the U.S.-Mexico border region to think about it as a region. That although it is where two sovereign nations come together, we can think about it as a region as we share so many aspects of health and economy, and I'll be able to talk to you a little bit more about that. So my presentation is going to be divided up into 3 sections. First, I'll give you an overview of the border and some of the unique characteristics that comprise the region. And then I'll talk to you about a story. One of the aspects that is unique to the border is the militarization, or the immigration policies in the form of militarization that really are challenging and impacting the public's health in this region. And so I want to talk to you about the structural and the everyday violence that is experienced in the region through militarization. And because I'm a good public health person, I'd like to end on an up note and talk to you something about that I'm very passionate about, and that's the role of community health workers, promotores de salud, and also community health representatives from indigenous sovereign nations who can play a role in building community capacity to advocate and work on those structural and social determinants of health through policy and systems change. So that's kind of where we're headed today. So this is the border region, and as you can see, it's made up of 4 U.S. states, 5 Mexican states, 44 counties, municipios, and 14 pairs of sister cities. And so sister cities really matter. So those are those cities that sit directly across from each other, and those are really the nexuses of binationality and transnational work. And there's 14 of those pairs of cities that share a lot in common and work very closely together. The border region that I know most about is the Arizona-Sonora, Mexico border region. We enjoy a long history of partnership, both in the public health sector and the academic sector. And despite what you hear on the news, we will continue to work together, and we enjoy many binational projects at this point. So as you also may know, the border is a very busy place with over $1 billion of business being done on a daily basis, people moving back and forth. So great economic vitality. But there are 6 characteristics that really make the border unique. And I want you to think about this in your own communities and see if I'm off. But these are the things that collectively make the border region very unique. That's ethnicity, growth, population growth, high rates of poverty, youth, and I'm going to talk about these, and shared infrastructure, which I'm not going to so much go into, but please know that there is so much health infrastructure that is shared between the 2 countries, and that includes health and thinking about medical tourism when your teeth hurts. Oftentimes it's cheaper to go down to the border and get your teeth fixed than it is to actually go to a dentist here in this country. Education, we can look at the great state of Texas that actually offers in-state tuition for Mexican nationals, so any Mexican national can come into Texas and get a higher education. Commerce, as I said, large trading partners. I'm imagining that the next time you pick up some asparagus, maybe this summer, you can look at the tag and it will say Sonora, Mexico, and that's just right around the corner from my house. Delicious asparagus if you like it. And the environment. So we share ecosystems, migration patterns in animals and birds, and all kinds of incredible nature. What I'll specifically talk about today through that story that I was mentioning is the militarization. So that's one of the key characteristics that does define the region. So as I mentioned, And we've seen today throughout the presentations, the U.S.-Mexico border is the largest concentration of Latino people in the United States. It's a vibrant, culturally rich, linguistically rich area, and it's growing quite fast. And so at current growth rates, the combined population of the border counties and the municipios, which are the Mexican side, will double in about 35 years. It's also quite young. So on the left-hand side, you can see the population pyramid for the U.S.-Mexico border region as it compares to the U.S. side. And so it's quite a young population with high rates of poverty. And so Latinos living in the border counties are more likely to live in poverty, as are children living in the border counties, as compared to both their white counterparts as well as the states. And high rates of uninsured, as we've talked about today, and I'm not going to spend too much time on this, but there are issues of medically under-resourced areas, but a lot of this disparity comes from the ability for the populations living in the region to access employer-based insurance, as well as qualify for some of the safety net programs that exist. And we share disease areas, lots of them, and the risk factors that go into them between the two countries, making a common agenda and thinking about a regionality approach helpful for us to leverage those resources that are needed to combat some of these. So I've given you a bit of an overview of the region, and I'll quiz you at the end about those 6 characteristics of the area. You'll remember youth, and I think it's growing fast, and there's a lot of Latinos, and but what I really want to sit with you is this idea of immigration policy and how it impacts the public's health, specifically the militarization of the region. And so these photos are pictures that my husband actually is a photojournalist, and he covered the border for a long time, so I'll give him full credit for that. But these are some of the surveillance patterns and interactions going on 5 minutes from my house. So the militarization of everyday life, you can consider it as the saturation and pervasive encounters with immigration officials, including local police enacting immigration and border enforcement policy with military-style tactics and weapons. That's militarization. This might be going on a lot in the U.S.-Mexico border, but I can almost guarantee you that in your own communities, you may be seeing that local police, especially in the state of Alabama, where they've copycatted a couple of our laws that we've generated in the Arizona to actually enforce some of immigration law through local law enforcement. What does that look like, militarization? Well, it can come in the form of identity encounters where you're actually asked about your citizenship based on what you look like, formal and informal checkpoints that pop up on your way home from work, keeping you kind of in a concentric circle, oftentimes discretionary identity inspections, so without probable cause you can be asked again for your citizenship, arbitrary abuse and detention of individuals, and the use of silence and coping to self-preserve. And so we can also look at some of the increase in anti-immigrant climate through the legislation that's been both introduced and enacted. And so I kind of got up to 2011, and I need to update this graph, but you can see that there are hundreds of laws throughout the United States put in for vote and also enacted that create climates in which people do not feel comfortable approaching different types of social services, namely public health departments for immunizations or taking their kids to school for fear that they may have some of these encounters of identity and be questioned about their citizenship and or might be deported. So the public impact of militarization, so we know that the cumulative exposure to institutional arrangements that systematically marginalize groups based on race and ethnicity and class can have a whole host of very deep problems with disproportionate vulnerabilities, stigmatization, discrimination, ultimately with deep disparities in morbidity and mortality among the groups that are targeted. So now I'm going to try to tell you what militarization looks like through a study that we did in the region with predominantly permanent residents and U.S. citizen farm workers of Mexican descent. So this is a random household survey of farm workers living in the region. And so what we saw was when we asked about how often do you see Border Patrol, so how pervasive is this? 90% of folks saw a Border Patrol on a daily basis. And you say, okay, well, yeah, they live in the border. It's a given. But let's think about where they see them. So imagine that you are working hard in your community, and every single solitary day in your neighborhood, or if you're part of that 90%, you see a Border Patrol patrolling your neighborhood. Or you go to your work site and you see Border Patrol there. Or you are at the corner store, at the Circle K, getting water, just shuffling around, or at the supermarket. So it's not the point of entry that you're seeing the Border Patrol, but you're seeing them in your community all around you. There we go. We talked to the farm workers who had an average of 15 years working in farm work. So this was an older population that were predominantly, as I said, permanent residents and US citizens by naturalization or by birth. And we talked to them about mistreatment that they may have experienced, immigration-related mistreatment. And so no less than 30% had reported some type of immigration-related mistreatment vis-a-vis a local law enforcement agent and or an immigration official. This mistreatment came in the form of verbal mistreatment, physical mistreatment, emotional distress, and particularly troubling is this idea that the rationale for having had the mistreatment was perceived to be because of racial or ethnic profiling, or quote unquote, looking Mexican, looking undocumented. So this kind of conflation with ethnicity and immigration status. We knew also that because of this was a farm worker population, that mental health and physical health was going to be an issue. Mental health was definitely not surprising. It matches a lot of the farm worker data that you see, but 30% of the population already were self-reporting poor mental health in the last 30 days. But what you need to know here is that any type of immigration-related mistreatment, be it personally experienced and or witnessed, we saw a twofold increased risk for stress. And so this is kind of a no-brainer as well. We understand the relationship between mistreatment and stress, but I think that we had not really unpacked or thought through this in the region until now. Witnessing immigration-related mistreatment of others is also related to increased levels of stress. So what does this particularly look like? I want to read you a story. This is a composite, so this was a study of quantitative and qualitative data of Gerardo, who's a 38-year-old married father of 3, and he had been working in U.S. agriculture since he was 17. And you can kind of see in bold, those are the themes that are coming out, this idea of profiling, discretionary detention, and physical abuse. And I'll just read one for you so you can kind of get the sense for what the everyday violence looks like. He was running for exercise near the irrigation canal when he was stopped and detained by immigration officials who thought he was undocumented. They made him lie down on the ground, which was full of insects, at gunpoint, until he called his relatives to bring his documents. The man believes this all happened because he is a very dark Mexican. So these stories go on. And remember, we're talking about permanent residents, people that have lived in this region for all of their lives, for more than 20 years. The more troubling piece of this is this idea that even though folks in this particular group of people do not have any real reason to fear making a complaint about this mistreatment, the fear is still there. Their fear is deep, their fear of retaliation from the Border Patrol, their fear of losing their documented status. And so this is kind of a real issue, because not only is there no place to go to complain about immigration-related mistreatment, the Department of Homeland Security is a very locked kind of gate at this point, but even if there was, people are so fearful that something may happen to them or their families that they are choosing not to to report the fear. So then in my last 4 minutes, I just want to say, how do we expand the boundaries of our research and practice to build health equity in this unique region? Be careful, because the quiz is coming. It's coming. Well, we listen. We heard today that we listen to local groups. This is groups from New Mexico that is actually leading the charge in terms of community organizing around protecting its citizens and having a voice, border reality checkpoint, and revitalize, not militarize. As researchers, we use collaborative and mixed methods to tell the story. So we participate, we listen, and we use those types of methodologies that really help us to tell both a quantitative and a qualitative story, so our policymakers can listen, so we can open the doors to the Department of Homeland Security maybe someday. We collaborate with and we leverage our partnerships with the federally qualified community health centers and all of the partners that have been mentioned today, to be able that we can effectively and adequately serve farm workers, immigrant, migrant communities in our region. With my 2 minutes left, my biggest passion is around community health workers, and this is the last part of my talk. And the fact that many of you might work with community health workers, but they are unique individuals that are lay leaders in their community. They represent the socioeconomic, cultural, linguistic, and lived experience of the community members that they serve, and they have the pulse on most community knowledge. And I have been working very hard through our CDC-funded Prevention Research Center to be able to understand how community health workers, through leadership and advocacy training, can actually change and convert their clients or their participants in their programs to citizens engaged in the political process. So citizens that have been historically marginalized purposefully from the political process, to be able to convert and bring them into the fold. And so this is a model here that we've developed and looking at from a national sample of community health workers from all over the country, watching and learning how community health workers actually engage in the building blocks of leadership and advocacy to create that space for a common voice of action, engaging community members and in the organizational advocacy, changing their own organizations to be able to better meet the needs of populations, engaging at that civic level, bringing community members to school board meetings, bringing community members to the planning and zoning meetings, getting people into the mix. And as we advance this model, this is coming from an even larger national study, one of the largest historically done of community health workers. We're starting to see how community health workers actually change the conditions within their, within their communities. And I'd love to continue to talk about this particular model maybe during the question and answer. But we're really seeing how community health workers are engaging in various levels to really take the voice of the people up to the top. And so that is all I have to say, and this is a beautiful sign. It's a mural from a migrant center at the border region, and it's basically saying in Spanish, if we don't think differently, everything will remain the same. So I encourage you to break your boundaries and your borders, and let's all think differently and collectively and creatively, as our speakers have inspired us to do so far today. Thank you.